This is Norma frontalis. This is Norma lateralis. And this is Norma occipitalis. This is Norma basalis. The upper part of this skull bone is Norma verticalis. Okay. First Norma occipitalis. See. These are lambdoid sutures. This is occipital bone. This is posterior part of parietal bones. This external occipital protuberance, and this line is known as superior nuchal line. Another line is passing above to this superior nuchal line known as highest nuchal line, that is present on some bones and may be absent also. So this is external occipital protuberance. This is superior nuchal line. Okay. This is mastoid process of temporal bone. This is mastoid process of temporal bone. These two. This is external occipital protuberance. Upper part of external occipital protuberance and medial half of superior nuchal line gives origin to trapezius muscle. Lower part of external occipital protuberance gives attachment to ligamentum nuchae, and lateral half of superior nuchal line gives insertion to sternocleidomastoid. Sternocleidomastoid is mainly inserted on mastoid process, but some part of sternocleidomastoid is also inserted into lateral half of superior nuchal line. This is Norma lateralis. The bones involved are greater wing of sphenoid, parietal bone, squamous part of temporal bone, mastoid process of temporal bone, and greater wing of sphenoid. This meeting point of frontal bone, parietal bone, squamous part of temporal bone, and greater wing of sphenoid is known as Pterion. Anterior division of middle meningeal artery lies deep to this pterion. So any fracture to pterion can damage the anterior division of middle meningeal artery, and this can lead to hemorrhage outside durameter, known as extradural hemorrhage. On the normal lateralis, this is mastoid process of temporal bone, and this cavity-like structure is known as external acoustic meatus. Roof, upper part of posterior wall of external acoustic meatus are contributed by squamous part of temporal bone, while lower part of posterior wall, floor, and anterior wall are contributed by tympanic part of temporal bone, or also known as tympanic plate. This is zygomatic bone. Now, this is zygomatic process of temporal bone. This is temporal process of zygomatic bone. This is frontal process of zygomatic bone, and this is zygomatic process of frontal bone. And temporal fossa. Yeah, temporal fossa is all these structures. In temporal fossa, only temporal bone is not present. Along with temporal bone, parietal bone is also present. Frontal bone, some part of frontal bone is also present. So all these structures are present in temporal fossa, while infratemporal fossa is this cavity-like structure. This is infratemporal fossa. This is lateral pterygoid plate. Okay. This is lateral pterygoid plate, and this fissure is known as pterygomaxillary fissure. This is pterygomaxillary fissure. Superior to this external acoustic meatus lies a imaginary triangle-like structure known as suprameatal triangle, or also known as McEwan's triangle. Now, boundaries of this triangle is roof is formed by suprameatal crest and extension of the zygomatic arch only. This anterior and this posterior wall. Now, the anterior wall is formed by upper part of posterior wall of external acoustic meatus, and posterior wall is formed by a tangent that can be drawn from external acoustic meatus. So this forms McEwan's triangle or suprameatal triangle. Clinical significance of this triangle is any pus can be collected here, so it can be easily drained out through this triangle, this McEwan's triangle or suprameatal triangle. This is Norma frontalis. Okay. The bones involved are frontal bone, nasal bone, and maxilla. Okay. And some part of zygomatic bones also. Now, this is nasal bone. Two nasal bones are separated by internasal suture. This is internasal suture. Okay. And frontal bone and nasal bones are separated by this frontonasal suture. Okay. And nasal bones and maxilla are separated by the nasomaxillary suture. This is orbit. These two are orbit. Above orbit, this is supraorbital foramen, where supraorbital nerves and supraorbital arteries are passed through, and this below this orbit lies infraorbital foramen, through which infraorbital nerves and infraorbital artery are passed through. Okay, this orbit, upper part of orbit is frontal bone, lateral part of frontal process of zygomatic bone. Below this is maxilla, and medial this is lacrimal crest. Okay. Huh. This elevation is known as superciliary arches, and this meeting point of superciliary arches is known as glabella. Okay. Huh. Another suture may be present above this internasal suture, that is known as metopic suture. Here it can't be easily visualized, but I can tell you verbally that some processes of maxilla are present, like uh, frontal process of maxilla, zygomatic process of maxilla. These are this is alveolar process of maxilla, in which teeth are attached. Okay, frontal process of maxilla, zygomatic process of maxilla, and alveolar process of maxilla. Okay, this is Norma basalis. We can divide this complex Norma basalis into three portions. We can imagine a line passing through this posterior surface of hard palate, like this. Above this line is anterior portion, and we can also pass an imaginary line passing through this superior border of foramen magnum. And then between this is middle, and below this line is posterior. This is posterior. Okay, so this is anterior, this is middle, and this is posterior. Okay, first we will talk for anterior portion. Okay, this is hard palate. Okay, now these are palatine process of maxilla, and these are horizontal plates of palatine bone. Okay, palatine process of maxilla are separated by intermaxillary suture, and horizontal plates of palatine bone are separated by interpalatine suture. And these two, palatine process of maxilla and horizontal plates of palatine, are separated by palatomaxillary suture. This is palatomaxillary suture. This crest is known as posterior nasal crest. I forgot to tell you, in the Norma frontalis, this is anterior crest. This is anterior crest, and on this Norma basalis, this is posterior nasal crest. Okay. On this Norma basalis, this is incisive fossa. Behind these incisors. This incisive fossa opens directly into this nasal cavity in the front. Okay, so this is incisive fossa. Okay. On this anterior portion of Norma basalis, this is greater palatine foramen, and these are lesser palatine foramina. It can be 1, 2, or 3 lesser palatine foramina. Okay. This is spine of sphenoid. Okay. This is vomer bone. This posterior aspect, these are mastoid processes, and this large cavity-like structure is known as foramen magnum. You may be aware of this. These are occipital condyles. Okay. The significance of these occipital condyles these occipital condyles articulate with the articular facets of atlas or C1 vertebra, forming atlanto-occipital joint. Behind these occipital condyles, these are hypoglossal canals. Okay, and these cavity-like structure are jugular foramina. Okay, this is foramen ovale, this is foramen spinosum, and this is foramen lacerum. Okay, so important foramina are there: foramen ovale, foramen spinosum, foramen lacerum, jugular foramen, and this is hypoglossal canal, through which hypoglossal nerve or 12th cranial nerve passes through. Okay, this is occipital bone. So this is external occipital crest, and this is external occipital protuberance, which I have discussed before, and this is superior nuchal line. This faded line is known as inferior nuchal line. Okay, this inferior nuchal line bisects this external occipital crest. This is inferior nuchal line, and this is external occipital crest. Inferior nuchal line, external occipital crest. This is all.